want to talk a little bit about the supervision contract. And supervision contracts are in some ways similar to informed consents that clients sign when they begin treatment. But a supervision contract is going to outline the frequency, duration, and time of when your supervisory sessions are. And I think this is important because it's very easy with the very hectic clinical responsibilities and agency responsibilities that you can't have a set time. But I think if you treat it as if it were a client appointment and you honor that time and you block it off and make it a priority, I think that really, first off, it would support the contract that you're devising, but also remind both you and the supervisee of the importance of it. You set the location, and if there were any fees, this wouldn't apply to any interns or practicum students, but for example, some supervisors do charge for supervision, for the pre-licensure supervision in varying ways. Your supervision contract does outline the purpose, the goals, and objectives of supervision. It outlines the methods and modalities used. And this would include, for example, your theory of supervision and whether or not you're going to use tape review or note review or interpersonal process recall. This would all go into the supervision contract. It's going to outline the responsibilities of the supervisee. And I talked about those earlier in the presentation, and so those would be in your contract. But I also want to add here about crisis notification. And this can come up as a liability issue as well. But I think it's really important that your supervisee understand when to call or come get you as the supervisor if there's a crisis, and what can wait till the next business day. For example, if let's say the client at 6 p.m. and the client that the supervisee has is suicidal, that's something that you would talk about with your supervisee, that I want to be called on my cell phone, even if it is after hours, when you have a clinical emergency like that, or I want you to call the clinician on call, but kind of outlining that. And also the means of contacting the supervisor, whether that's via cell phone or email or office, but especially with crisis situations of when and how to notify. In the supervision contract, you're going to talk about the method of evaluation. How is the person going to be evaluated? What aspects? Is it related to reliability with regards to being on time and keeping appointments on time? Is it related to initiative? Is it related to, are they going to be evaluated on how well they implemented CBT techniques over the course of supervision? I think you also need to discuss the limits of confidentiality within supervision. With confidentiality, because you are in a gatekeeping or an evaluative role, it is somewhat limited, much like if a client is a danger to himself or others, and you have to break that confidentiality. If your supervisee is a danger to clients or having some sort of an adverse effect, you cannot necessarily guarantee that what is discussed in supervision will stay there as long as you are complying with the due process requirements that you outline in your contract. Another piece of the contract would include your credentials and disclosure statement, including your experience and training in clinical supervision. And I also add a piece in the contract that the supervisee, and of course myself as well, will adhere to the corresponding codes of ethics, whether that's APA, ACA, etc. It is very important, just as with clinical notes, to document the supervision session. So I encourage supervisors to keep a supervision note that will detail some of the, not only the topics being discussed, but also some of the structural monitoring. For example, we'll talk later about 100 hours of supervision being required in no less than 50 weeks, and how that will look for the board when you have to count and keep track of and document the hours. But this is one example of a supervision note that would include the report of supervision, the date, the time, where it was located, the names of the persons present, if this was, for example, triadic or group supervision, and the summary of the content of what was discussed, any assessment or evaluation of the supervisee. This note can kind of prompt you to remember to evaluate and provide feedback about that, and plan for the next session, and possibly any comments that occur with that. So I think this is one way to keep track of it. Another trick of the trade I do, and I kind of model this for my supervisees, is we do the note together at the end of the supervisory hour. So when there's about 5 to 10 minutes left, I give a prompt and we write together, okay, what stands out to you about what we talked about today? And I have the supervisee tell me what they remember. And then I also process out loud what stood out to me and what I remember, so that the supervisee can hear me and hear my thoughts and my conceptualization. And because eventually the goal is you want to get them to start thinking like a supervisor. And this helps kind of get this in their head. And so you document together. And then that way it's more structured, where you can talk about, well, this is my assessment and evaluation of your cases or your skills for this week. And so making that a more structured process. It also saves you time that you're not having to then kind of multitask and continue to document after the supervisory hour. Another one of the practicalities of supervision is knowing that, of course, we have to ensure accordance with ethical and legal fulfillments for our supervisees. So especially when you are orienting your supervisee to the process, when you are talking about adherence with ethical codes, ensure that your supervisee knows the limits to confidentiality and knows the reporting laws. For example, if their client discloses abuse or neglect of a minor or incapacitated adult, knowing that, first off, that the supervisee has verbally informed the client of the informed consent and their limits to confidentiality, but also letting them know that, for example, that they're in supervision, because that is another limit to confidentiality, where the supervisee needs to say that, you know, I am in supervision and I will be discussing our cases with my supervisor, but then it's about my training and learning in the process. You also are responsible to ensure that supervisees are implementing evidence-based practices, that they are not kind of going off and doing some techniques and things that are not necessarily conducive to positive therapeutic outcomes. You also may consider a liability insurance rider if you have liability insurance. For example, there's one that's a consultation rider that kind of covers some of the liability as you're monitoring someone else's clinical work. This, varies. I'm sure it varies based on your insurance policy. Usually it's about $25 a year. Because there is, of course, a vicarious liability that you have as a supervisor, the legal term being respondeat superior, which means let the master answer. And hopefully this doesn't come up too often. One case I'm aware of was where a clinician, a postgraduate clinician, was doing in-home therapy, and it was the therapist ended up entering into a sexual relationship with a minor female during the course of the in-home therapy. And there was a successful case where the supervisor was sued and the agency was sued for failure to monitor, that there should have been, that they should have known that this was a possibility and should have monitored and intervened. So again, hopefully that's a very rare occasion, but if it were to occur, definitely you have that vicarious liability to consider. Also, some of the supervision basics is to ensure attendance to culture and diversity. For example, I know in the counseling program, in our model, we are trying to place interns in sites where they have access to clients representing ethnic and demographic diversity. And so this would be an example of making sure that the supervisees are getting access to a variety of clients when possible, whether that's clinically or culturally. And considering some of the cross-cultural variables in your supervision, race, ethnicity, gender, sexual orientation, religion, class, socioeconomic status, etc. Because it's not just between your supervisee and their client, even though that does need to be addressed. It can also be between you and the supervisee. Sometimes there are cultural differences in conceptualization, sometimes there's training differences, but not forgetting there may be some cultural aspects going on within your dynamics. Darcy Granello has a model where she uses Bloom's taxonomy and applies it to cultural issues and cultural competence. So, of course, Bloom's goes from knowledge, comprehension, application, analysis, synthesis, and eventually to evaluation. But realizing that sometimes, especially with the lower autonomy supervisees, that you're focusing more on knowledge and comprehension. However, once the supervisees get into the analysis and upward stages, they should be expected to integrate more of the cultural components and be able to process this as it applies to themselves, their clients, and the supervision. And finally in this section, we have evaluation and gatekeeping. Because this is a reality of supervision, whether we're talking about in the pre-graduation realms or even the post-graduation pre-licensure or even post-licensure. But if there is some sort of an assessment used, for example, a university form or instrument, I always attach that to my supervision contract. So that the supervisee is aware of it and knows what they're going to be evaluated on. I think it's also important to obtain multiple data points, not only to make sure you're seeing all the supervisee's strengths and things that they're doing well that you may not notice or you may not see in your context, but also if there are any concerns. Can I ask yourself, okay, is it just in supervision? Is it just within our dynamics? Or is it happening with other colleagues at the agency or at the site? And then most importantly, asking, is there a parallel with the client? Are the concerns I'm having or I'm seeing or I'm experiencing, is the client experiencing them as well? And this is where it's so important of your documentation you've had of your supervision sessions, you're watching the videotapes and reviewing those tapes to ensure that any adverse effects are being monitored and handled. Because I think it's really important that we communicate, and so I have communicate. If they don't know, then they can't change. And so we can have our concerns, and it is our responsibility to communicate so that they have the opportunity to remediate. Hopefully most of us or hopefully none of us are in the practice of kind of unfairly trying to drop a bomb and on a supervisee and kind of get them kicked out or anything like that. Hopefully that's not any of our style. But we do have to give them the opportunity to remediate if it is an appropriate deficit or skill to remediate. And if they cannot, and if they either cannot or do not remediate any of the deficits, then it is appropriate to proceed with a more formal process of removing the trainee from the client contact. Again, following due process. I would also recommend too, if you have any concerns, especially towards the more serious end, that you consider a second opinion from a peer. You send that, whether that's somebody else to begin supervision with the supervisee to confer with or to confirm some of the suspicions and again document any consultations.